My name again is Teresa Kittredge. I'm the founder of 100 Row Women, and just really happy to have you here this morning. And we'll say this probably 5 times, but it's like, be active in the chat, ask questions, put ideas in there, links, resources, any of those things. And Alexa, why don't you kick us off?
Yeah, well, thank you so much, everyone, for joining us today. I know we're still going to be getting a few in the next couple of minutes, but some of you I see have joined us before. But if you haven't, we're 100 Rural Women, and we're all about creating connections and inspiring leadership. And we see a future where more rural women lead positive change for themselves, their families, their communities, and eventually the world. And we're committed to building leadership networks through education, things like this, and civic engagement. And our organization is nonprofit and nonpartisan. And our mission is really to just serve and support rural women, specifically right now in Minnesota, but we're expanding to the whole country. And the Breakfast Club is really about doing some of that stuff that lifts up rural women's work. And so that's kind of what we're here to do with the American Lung and Pat and Erin here. And I'm going to give it to you, Teresa, to give them the rest.
I love it. Thanks, Alexa. And yeah, just to build on what Alexa said, this was a Breakfast Club. Our webinar series was one of the first programs we started, and we launched during COVID, which was interesting. So it was a good way for us to lift up women leading around, really difficult issues, tough issues. So that's Liz Johnson. I met early on when we were starting 100 Row Women, so I was really happy to connect with Liz and to be able to lift up women doing work around the issue of vaping. And I got to tell you, I've sure learned more about it through this experience, and I'm hoping everybody else does see what a critical issue this is and is able to really garner in some of the resources and share the resources. And so I want to introduce our presenters just briefly today and then ask them to tell you a little bit more about themselves. But we'll start out with Pat Mckone. And Pat is the Regional Senior Director at the American Lung Association of the Upper Midwest. She's worked with lung health programming for over 40 years. Her work has included tobacco treatment programs, limiting youth access to tobacco, public and school-based education, raising awareness of the impact of tobacco, mental illness, and substance abuse disorders, as well as advocating around limiting exposure to secondhand smoke, smoke-free housing, point of sale, and e-cigarettes. So welcome, Pat, and thank you so much. And I want to introduce our other presenter today is Erin. Erin's from my hometown of Mankato, and she is the executive director of Mankato Youth Place, which is my place. Before working at my place, Erin spent 15 years with the American Lung Association as a training and technical assistance provider, supporting communities working on policies to reduce tobacco harm, including smoke-free bars and restaurants. Erin was a founding board member of the South Central Minnesota Food Recovery and has been involved in several other community-based initiatives. Erin lives in the Mankato area, has lived there for 21 years, and she lives there with her husband, 4 children, and attended MSU. So welcome, presenters. And Pat, did you want to kick us off?
You bet. And thank you, Teresa. I am the Pat Mckone. Some people say, oh, I finally get to meet you because I've been around a long time, but I really appreciate this opportunity to talk with you. And what a great organization, lifting up young women's voices and including us older women in the conversation, because once an advocate, always an advocate, and actually a bolder advocate as the process goes on. And I'm really glad that Erin can join us. I really miss her, but I'm really so proud of her work beyond the Lung Association. So we keep connected. So Erin and I met earlier this week and just said, I'm going to present a few slides about vaping, and just so we're all on kind of a same page or platform of what we know about these to start the conversation. So I'm going to screen share. Right here, and I'll share, and tell me I've got the right screen, because you would not want to see my desktop. Yes? Yeah. Okay. So let's talk about vaping, setting the stage on what's going on, both in our state and country. I do want to say when I talk, and I'm not giving you a half-hour presentation, there's about 10 slides, that I am talking about commercial tobacco. That's the stuff when you walk in a convenience store, you see behind the counter, not the sacred tobacco that's used for ceremonial, sacred, and medicinal uses by the American Indians and other groups. So the evolution of e-cigarettes, it's really interesting that you're the 100 rural women, and actually the first phone call I received about what are these things came from a rural community that was hosting their county fair, and there was a booth there that was selling e-cigarettes. And this was probably 15 years ago, and I had never heard of the devices. It could be longer. Years go by really quickly at some stage. So this is kind of, they started out looking like a cigarette. That was the purpose was supposedly to help people quit smoking, although that was just a ruse. And then they have evolved over the years, and really the devices that we have in the schools and with our young people today are very different than the other devices. They are much more potent, much more effective in getting the nicotine to the lungs, and many more opportunities for inhalation of a drug throughout the day. So people have asked, just about what's the equivalent of a kid who's using a e-cigarette device to cigarettes is kind of we look. Well, this is these are the early devices, and you will see, a pack of cigarettes, we know how much nicotine is in them because they're regulated. The Juul pod, which really launched this epidemic because of the new formula of how the nicotine was delivered to the lungs in a much more effective way. The puff bar, equivalent to 2 packs a day. Now, I have worked with kids for decades. I've never met a kid in high school that was smoking a pack a day. It was just too hard to find the time to light up, to find the place to sneak. If you were going to light up a cigarette, you dang well better smoke the whole thing because you didn't want to waste it. Unlike the ready available, just take a hit and you've got some nicotine. And on top of that, try to smoke a cigarette in a room or even on a block or even in the car in front of you, and people can tell that it's happening. Not the same with these products, because you're hard pressed sometimes to think, was that Bath Beauty and Beyond product or was that an e-cigarette? And now this is 2022, and we have much more powerful devices with more puffs in them. And you should really be like gasping for lack of it. The Escobar has equal to 15 packs. You go all the way up to 35 packs. The Loon is a very popular product in our state. It's made in Minnesota. It is very present in the metro area and beyond. And it says 4,000 puffs, but there are now devices that also have 8,000 puffs in them. 8,000 puffs of nicotine. It's just stunning. And so I'm very concerned. I'm very concerned because nicotine is one of the most addictive drugs out there. And these are young children with developing brains. So this is a little technical, but I think I'm going to explain it to you. And the reason Juul became so popular is they suspended the nicotine in a salt base, which I didn't do really well in chemistry. So I'll just say it was a better formula for getting the drug into the lungs and out into the body. And you can see on this slide, the average e-cigarette really had low uptake. And what makes a drug addictive is really its ability to get fast to the brain and get a quick hit, because the fastest way to get any drug is to inhale it. That's why they freebase a lot of drugs. It's faster than injecting. If you inject a drug, it's got to go to your heart, back out to your lungs, back out to your body. When you're inhaling it, lungs, heart, brain, out. And so it almost mirrored the delivery system of the combustible cigarette. And that was the magic in what happened with Juul, is they found a way to mimic the delivery of one of the most addictive drugs we know in the same way as a cigarette. And the brain is the brain, and drugs are drugs, and they activate the center that releases dopamine. The pathway for the release of that drug is the same pathway for nicotine as it is for heroin and cocaine, alcohol. And we are very concerned about this epidemic because the brain is one of the last things in the body to fully develop. And I have to say, for some people, it never develops. But the average person, it develops at age 25. And interfering with these pathways at a young age makes the person much more susceptible to a lifetime of addiction. It's like nicotine opens that pathway and enhances the delivery of some of the other drugs. And so one of the ways we tell if a person is addicted is we just say, how soon in the morning before you reach for a cigarette or you reach for whatever drug it is? It's usually cigarette. People used to ask me when I was teaching quit programs, how do I know I'm addicted? My answer used to be, if it's 3 in the morning, it's 30 below, you wake up, you get dressed, you go to the convenience store, not to fill your car with gas because your tank is low, but to get the drug. I mean, that's a sign of not, you're not in control. So the question is, do you use this product within 5 minutes of getting up? And just look how that has spiked. This is youth telling us, I use 5 minutes upon waking. Now, the pandemic numbers are in there. You see 2020 and 21. I think that's the pandemic reflecting the numbers. I think once we're back into our new normal, we're going to see those numbers even go up higher because of these bigger devices with more puffs in them, etc. So what does that look like? I mean, just think of what this looks like in classrooms or in our families when somebody is in nicotine withdrawal. The reason people say smoking helps them relax is because they're in withdrawal. And whenever you get your drug, you get a sensation of, I feel less stressed and relaxed. So symptoms are, the craving, they're anxious, they're depressed, they're tired, they're trouble sleeping. E-cigarettes have been linked to trouble with sleeping, tense, restless, frustrated, hungry, and having trouble concentrating. I'm very concerned about this impact of keeping kids in school. Really, it's just going to say, you heard it here. So the bottom line about our main concerns around the nicotine and the delivery systems are, it's still a developing brain. It has all kinds of challenges for learning. It has also set up the young person for a future addictions, and and you can overdose on this stuff. It says nicotine sick, that you'll hear school nurses talk about kids convulsing, having seizures because they've been vaping. So mental health is something I'm very concerned about in this overall, but we know that students with long-term mental health problems are more likely to have used tobacco products in the last month. And again, this is not post-pandemic. This was pre-pandemic data. I have to think it's all of that and more. And we can see that the prevalence of long-term mental health and vaping down to 8th grade. It's not unusual that I hear from schools that, they have 6th graders, 3rd graders trying vaping, and what are they to do? You see mental health is very much tied. Kids, when they're asked why they're doing this, they talk about being depressed, being anxious. This is also data from 2019 when, again, we were not at the peak of vaping and not had these devices, but just, this is Minnesota data. I just think you should take a good look of anxiety and depression and usage. Ever considered suicide and ever attempted suicide? And I have really encouraged schools when they're working with students that are showing the addiction, they really need to do a mental health assessment and start treating what's going on and not suspending or expelling kids, because this is a public health issue and not a criminal justice issue. They're also more likely to use alcohol or marijuana. And again, we are legalizing. We know at one point about 2/3 of kids in Minnesota that were vaping have said that at one time they vaped both nicotine and THC together. This is before the legalization. We've got a year to go, and I think schools and parents and grandparents in our communities are very concerned about what's going to happen next, because my belief is that most young people are going to choose the delivery system for cannabis to be vaping. And because we're rural, I wanted to share this slide. It's not those big city kids that are using it the most. It's actually greater Minnesota. They are more likely to have used a tobacco product in the last 30 days in greater Minnesota versus metro. And that goes all the way down to the 8th grade. And I think younger also. What flavors do they like? They like them all, but they really use these products because they are lured. They've been targeted. There's so many reasons why. The only bad in all of this is the industry that has marketed this candy flavored drug to kids. And that's where we're getting active with the Smoke Free Generation Coalition to pass legislation. I mean, we can catch kids with vape detectors in schools and we can chase this and that for decades, but we can't do anything that's going to be more effective right now than restricting all flavored commercial tobacco products. And I will say that we're also going to make a pitch that vaped marijuana products also not be flavored. So that's our coalition, and we're going to have this the focus of our legislative session. I just want to encourage voices. I said yesterday I was at in a school nurses meeting and talking these same issues and saying we really need our decision makers to hear from everyone in communities about this epidemic, and that restricting flavors is key to reducing this epidemic with our youth. So we can take action by, again, our legislative agenda. I also work for a nonprofit. We are a C3. I kind of think if you're incorporated, you're also a C3. C3s can lobby. You know, there are restrictions on how much we can lobby, but we've never, ever come close to those restrictions. And nobody takes away your ability to be a citizen when you're not on paid time. So you could, if you're interested in Day at the Capitol on March 5th next year, it's a great time to go with a group. We have about, I think 200 people that come to Day at the Capitol and meet with their legislators, their decision makers. If you're not able to do that, talk with your decision makers. And who are those folks? They're city councilors, they're your local law enforcement, they're your county commissioners. Tell them about this issue and then listen what they're experiencing too, and how we can work together to really change the trajectory of this epidemic. So we have a toolkit. Our folks have worked, I would say Liz Johnson really helped launch this. We are trying to bring youth voices to the Capitol because it's hard to get a day off to go, and just having their stories about how e-cigarettes or vaping has impacted their life. And I can tell you, we get a lot of them that say mind your own business or whatever, but you get those ones that really say, I'm addicted and I'm not able to stop, and I've lost friends. I can't enjoy going with my family because they don't want me vaping. I've tried to quit and I'm really struggling. So it doesn't take a special card like this. We can have anyone fill out a card and really bring those voices in mass to the legislators next session. Here are some of them. I've tried a bunch of flavors. They all have the same feeling. I can't think properly without my hit of vape. That's a sign of addiction. Remember, one of the signs of withdrawal is they have a hard time concentrating. My family's tried to stop me, but I vape in secret. It's so easy to do in secret. In 5th grade, I was forced to vape by some of my friends. The main time kids start any kind of drug use is that a friend or a sibling introduces them to them. I tasted like strawberries, so I tried it, and it tastes good. Unlike smoking, where the first reaction is, oh my gosh, I'm inhaled this, kids puke, throw up. You learn to smoke. Vaping is very easy from the first puff. Okay, harder to breathe. And then here's the QR code for registering to get a kit. If you have any kind of group you work with young people, these are some great activities, but mainly getting those voices and getting them back to all the tools you need to make that building those voices together in the toolkit. All right, that is the end, and I'm going to stop sharing
Well,
and maybe pass it to, go ahead.
yeah, I was just going to say thank you so much. And just for everybody's information too, we'll be doing follow-up from this webinar. We had some folks that couldn't make it, and we also want to share everything on our website. So we will have links to the toolkit, Day on the Hill, which I love. I think that's such a great idea. And I just think for policymakers to hear young voices is very impactful and super important. But Erin, did you want to say anything before we jump into some questions?
Sure. Well, thanks so much for having me. I started working on tobacco policy work in the early 2000s when we were working on smoke-free indoor air, which is hard to imagine now that we were going into restaurants with our families with smoking happening. But that was really my first awareness of what was happening in our rural communities. I worked in Hutchinson, in Mankato, out in Wilmer, and the tobacco industry was sending people to our rural communities to have meetings with bar and restaurant owners who, in rural communities, those are our friends and neighbors, right? We know the people who own the bars and restaurants in our communities. And they were having meetings with them, teaching them how to cheat the books and demonstrate poor impact of these policies. And the division that came during that time was really significant and was a big eye-opener for me, but also really energizing. During those years, I talked a lot when I went out into various communities about these kids who were targeted, and these low-income kids and kids of color. And now I have the good fortune of being able to work directly with those kids. They are the kids who come to Mankato Youth Place. And no kids deserve it, but surely these kids do not deserve to be targeted by this industry. I knew the statistics of the tobacco industry targeting our kids, but spending almost 5 years in a building serving kids in our downtown corridor, which is our lowest income area of the community, I could see the signs in the convenience stores, in the liquor store that's rooted in a residential neighborhood, which, my neighborhood doesn't have a liquor store right in the middle of housing on a street corner. Seeing a pot machine located on the sidewalk, low-income kids are being targeted by a number of different industries. And it translates to real live children who deserve opportunity and healthy living. Last year, I received a phone call from one of our school principals, and she was calling me about one of the kids that we served. And that kiddo was a 4th grader, and they were pretty sure that she'd started vaping in the bathroom. And they weren't sure if she was vaping nicotine or marijuana, but they really felt like that was happening. And so they wanted to raise our awareness of that. And most interesting to me was that they were pretty sure, but they weren't so sure that they felt that their school policy would allow them to search this kiddo's backpack and locker, which I found to be really interesting, because then because they couldn't do that, an intervention also couldn't be had. And so this little one, throughout the school year, they continued to believe that was happening. Pat mentioned earlier how important it is that school policies around tobacco products not result in expulsion or suspension. The kids that I'm serving at Mankato Youth Place, many of them don't have a safe place to be and belong when they are not in school and when they are not with us. And so when school policies result in suspension, they're being suspended to a hotel room. They're being suspended to a drug infested home. They're not better for it. They're not going home to appropriate consequences and a nurturing parent that has the ability to help them through that. And so as we're thinking through policies, it's really important to think about what is the consequence of the policy. What happens if this is the road that we go down to the kids who are being impacted. And then, Mankato West High School, for those of you who are familiar with Mankato, is located in our downtown area. It's on an intersection. And so when you stand at the front door of Mankato West and look out into the community, you see 3 other street corners. One is Quick Trip, so a convenience store that has a lot of tobacco marketing. The next corner is a tobacco retail shop in a strip mall. And the next corner is Cub Foods, with the liquor store being on the high school side of the building, again, with significant signage for both alcohol and tobacco. That's no coincidence. That is by design. As soon as our new middle school was built a few years ago, the first thing to go up in that neighborhood was a convenience store. And so they're seeking out our kids, and they're targeting them with their signage. And then the last thing that I'll say before I turn it back to you, Teresa, is that so often people are they feel like they're too nervous. They're too nervous to talk to their legislator, their city council member. They're too nervous to testify. They wouldn't do a good job. But the truth is that the nervous voice is the best voice, because within that nervousness is a demonstration of passion and stepping outside of your comfort zone. And there's a lot of respect from the listener when they hear that in your voice. And so I think it's most important for people who are stepping outside of their comfort zone to be the ones who are speaking on the behalf of our kids.
I love it. Thanks, Erin, and thanks, Pat. And just want to remind people, if you have questions, when we're going to move into an open question and answer period shortly. But if you have questions, just pop them in the chat or message one of us if you don't want to ask it. We're more than happy to do that for you. But as folks are thinking about questions, I just have a quick follow from both of your comments. You hear nightmare stories about impacts on physical health. And I know we talked about that a little bit, but you hear nightmare stories about lungs collapsing and pieces like that. Can you talk a little bit more about the physical impacts that, from the research or observation, or anything you could share with the group about that?
Sure. It's a great question, because we all remember, I think we do, with the pandemic, memory is clear. But right before the pandemic hit, actually it was in the late 2019, there was a disease called Ebola that was hitting. It was first discovered in Wisconsin, young people vaping, ending up in intensive care on ventilators. And the only common denominator was some vaping going on. Minnesota was the second state, and then Illinois. And after lots of investigation of what it was, it had to do with the e-liquid and some illegal cartridges that contained THC that were contaminated. And these young people, some of them have permanent lung damage. I mean, on oxygen now for the rest of your life. I think we're just learning. Remember, these devices are just a few years old and a few decades old. And we know like 60, 70 years of the science around combustibles. But I just this week saw an article of a young man in Chicago in his late 20s, early 30s, vaped for 10 years and is now waiting for a double lung transplant. I myself was at a gathering a couple weeks ago. I knew this pulmonary doc, a lung doctor specialist that was there, and said, what's going on? And he talked to me about a patient that he was trying to figure out what was going on. And again, the only thing he could offer this person was a transplant. And he said, she finally admitted she was vaping. She had been vaping for 10 years and had quit smoking, but was continued to vaping, and now is ready for a transplant. And I'm sure in her head, she thought, oh, this is not as bad as, but the truth is, for somebody, when we think about all these kids who are currently vaping, they never smoked. So is this better than breathing clean air? I think the lung, it's yet to be determined, the long-term impacts. I have to believe that anything you inhale should be as clean air as possible. And in these products, they weren't regulated for years. And then you can mix your own. So there's a concern about even sharing a device because reports of fentanyl in them, reports of meth in them. It goes on and on, Teresa. So, we're still learning, but for sure we know it's not as healthy as clean air. And that should always be our public health standard. I'm so tired of people saying, well, at least they're not smoking. My gosh, texting and driving is safer than smoking. Do we want them all to text and drive? Well, at least they're not smoking, they're texting and driving. No, we want them to breathe clean air.
Erin, did you have any feedback? Oh, go ahead.
We first started going out and testifying in various communities around this issue, people would come in sobbing. Women in particular would come in crying. They'd be wearing their e-cig on a lanyard around their neck, and they'd come in crying that we weren't excited that they had quit smoking and they were vaping instead. And, like Pat said, the science is new, and yet it's not. There really isn't anything that we should be breathing in other than pure, clean oxygen that anyone has ever said, well, that's great. That's really good for your lungs. Asbestos, radon, emissions, fire smoke, all of these things we know they're bad for our lungs. So we don't necessarily have to wait to find out if this other thing is bad for our lungs. We can make some really good educated assumptions about it. And I would often tell people that I really hope that they're right and I'm wrong, because if I'm wrong, they're going to live. But if I'm right, the consequences to them are just so very significant.
Absolutely. And I see Janelle has a question in the chat. Janelle, do you want to ask your question?
Sure. We have been, so I'm the superintendent for Painesville schools, and we clearly have been working with and dealing with vaping for, it's just become so incredibly problematic. And kind of to confirm some of the conversation, it is primarily our middle school girls, early high school girls that are our frequent flyers in our bathrooms, and they're pretty tricky and pretty savvy. And so we've been looking at really twofold. One is vape detecting, and I realize and I recognize, Pat, that that's not the solution, but we also have to eliminate the possibility for them. And when you can't intervene immediately, it's just so, it's not helpful. So that's one piece, and the other piece to that then are programs to implement. There are some educational programs that have immediate. So if you would find a student who is vaping, they could have, as part of their consequence, right? Not excluding, not charging, none of those things are working, right? We know that. But then having some immediacy for an education piece. Well, in looking at that, what we've found is there was the lawsuit again that the state of Minnesota, they got a settlement from Juul about, so where are those funds and how are they going to be used? The Philip Morris case was a huge money back into schools to educate, to, not just schools, but just money in a whole for the state. Where is that money and how is that going to be distributed? Or have you heard anything about that?
Oh, yes.
Because our local legislator is not sure what the process is yet. And maybe it's too early, but no. I'm hopeful that could be something that we could explore.
Yep. Well, thank you. And thank you for your work. Being a superintendent is a big job these days for anyone. And I think, thank you for that. So yes, we do. I was intimately involved with the Juul, helped identify testifiers for the case. Minnesota sued Juul, but trial by jury unlike any other state, and they did settle, just like we sued the tobacco industry. Just FYI, you know, we did win actually, you know, a lot of money from the tobacco lawsuit, but all of it went to the general fund every year. I mean, I always think if you won the Publishers Clearinghouse, and you had that choice of you get the one-time settlement, you know, payout, or you get payments. Depends how old you are, what you take. But the truth is, with the tobacco settlement, we got a one-time payout and payments into perpetuity. That means forever. And the state gets hundreds of millions of dollars a year, and it all goes to the general fund. None of it was ever dedicated for prevention.
Oh,
Zero,
okay.
not 1 cent. So Jewel, we learned a lesson with, and you should, you know, again, here's many of the voices were women's voices. I want to say that in public health, that's just how it is. And legislation was passed this last session that the Jewel settlement money, should there be any, this was before they settled, and any additional funding from the lawsuits related to nicotine addiction would go to the Department of Health, and that's where they're going. The first check has already been given to the department, and they are going to release a request for proposals in early spring. Now, depends what you call spring in Minnesota, right? I think they're shooting for March. I know they've done listening sessions already. They've done multiple of those. The focus will be on prevention. I would be surprised if they look at detectors without a really comprehensive program. I think one thing about detectors I hear from the kids that aren't vaping, it keeps them out of the bathroom. There's so many kids that won't go into the bathroom because they don't want to be associated with getting caught. And I just yesterday, the school nurses told me they have bathrooms in their offices, some of them do, and kids are coming there to use the bathroom because they don't want to take the risk of going into they're not even, they also corrected me, they're not called bathrooms anymore, they're called vaping lounges. So I think detectors, you really have to think about, okay, I'm going to catch them. What am I going to do? And what happens if they're really struggling with addiction? I think we've got to look at the American Academy of Pediatrics guidelines. We need to treat them for addiction, and that includes the possibility of using nicotine replacement so that they can make it through that school day and not be in withdrawal all day and, you know, causing disruption.
Right. So I guess what I would like to see is that's, I mean, so if it's going to the Department of Health, how does that trickle out? Right. I mean, where is that, what is that program going to look like? So if it's about treating addiction, I can't hire a mental health professional, much less an addiction counselor, right? I mean, how are those, what are some of the very real things if this is, if people become so frustrated that this is happening in our schools and we can't, you know, the vape detectors aren't the right tool, then what's the tool and what's the right? So let's advocate to funnel that money to some very real immediate resources. Do you know what I'm saying?
I do know what you're saying. Yes. And remember, that money could help buy some of those resources or access to them to treatment. So I would, and I know there's a shortage right now of mental health workers. I do know that, but we can't just give up on that. So the first round, it's actually the first round was not competitive. It's going to public health, but I'm going to say again, the RFP, the request for proposals that's going to come out, and Janelle, I'm very happy to send it to you when I see it. I don't know how it'll be. It will be distributed widely. It's usually in the Department of Health announcements what is available. Schools will be eligible. I have no doubt about that. They're going to look for a comprehensive plan. They're also going to look for communities. If we don't get a law passed at the state level, they're going to look for communities that are going up that stream and looking at flavors, because we do have many communities in Minnesota that have restricted access to all flavored tobacco products. That's a key. That is really a key. I think that I also didn't mention at all the environmental waste of schools collecting these devices and having to dispose of them. You know, another expense. I keep saying we need a policy where you buy these products, you pay a disposal fee of $5, $10, whatever it costs to get rid of the toxic waste that's both electronic. There are batteries, there's the liquid, and there's electronics within it. So, Janelle, I'm really happy to do that. I'll also follow up with some packets of resources, because there's parent education. You know, the school can't do it alone. The best testimony I ever heard, well, one of them in Duluth when we did limit flavor products, was the three women principals marched up to the podium at the city council meeting and said, "We've done our part. We need your help. Schools cannot do this alone. We need the community to say, we're in this together."
So Janelle, I am the executive director of Mankato Youth Place. We serve 60 to 70 at-risk kids every day. And so we're really different than a school and yet have some similarities. And I work closely with the schools. I think it's probably a lot of the things that you're already doing. I mean, that you could offer a cessation program at school, but in all likelihood, it's not likely going to work. You know, they're really tricky to have them be impactful. So things I think about at our organization are, you know, what are all of the ways that we can limit bathroom time? We've made it not very fun to go to the bathroom. There's not group gatherings in our bathrooms. One person is going from each room no more than one person is going to the bathroom at a time, because all the bad things happen in the bathroom, not just vaping. Yep. That the devil is in the bathroom.
And we've looked into, because that's also a very common theme that we're seeing, is that, you know, kids are so savvy that they're scheduling their time, and maybe one person hasn't and the other person doesn't, and they go in and they exchange, and they, you know, so we're very aware, and we're also looking at bringing in some digital program to be able to track how many kids are out of all classrooms at one point in time. But all of those things, they all cost money, right? And when you're in a school district that has had declining enrollment, and you're trying to prioritize an adult and an individual, those are those things where it's like, okay, if you can tell the story about how having some of these resources to limit that passing time, if that's kind of what some of the strategies that districts have used that's been working, that'd be awesome. You know, I mean, and we're looking into how to do that, just despite the cost, because it really is, I think, keeping kids out of bathrooms it's a way to just limit some of the possibility to make poor decisions, you know. And we've talked a lot about that as adults. That's part of our job, is to make sure that we limit the opportunity to make poor decisions.
The amount of bad decisions that are made in the girls' bathroom are stunning.
It sounds like a title for a book.
It could be. There are stories.
Yeah.
And then as far as mental health services, my hunch, just based on the kids that we serve and being a mom of teens and young adults, the kids who are vaping at those really young ages in particular, they're already on your social workers' radar. And so just adding that to the list of concerns, most kids who are using at those really young ages, there's a lot of other things that are already going on.
Yeah, I will say though, for these devices, this path, I mean, I think, you know, let's stereotype. We could in the past say, oh, here's the kids that are probably going to smoke. Poverty was one of the biggest predictors of smoking combustibles. If poor kids smoke at a much higher level, it makes no sense. It's counterintuitive but with vaping devices, it's athletes, it's student council, it's doctors, it's doctors' kids, it's, you know, the blue collar worker kids. This is not like, it's still very cool. It is a cool thing. It's trendsetters. It really has passed lots of those stereotypes. Or like I say, these are kids that would have never touched a combustible. They just wouldn't have smoked. Yeah. And thanks to the marketing of the industry. And we're not seeing it because you're all cool and but you know, these are young kids they're going after. Middle school is the highest growing number of kids vaping, middle school. And I don't think any of you said I'm a middle schooler.
Yeah, I did pop a couple of things in the chat, and we'll share all these links on our website afterwards. But this is a little bit about the Juul settlement, but it's a really good example that Janelle brings up of Department of Health. You know, and the dollars are going there, which is great. But then how does the Department of Health working with MDE and the school, you know, Superintendents Association, School Board Association, all those pieces. So I had gotten an email question from somebody who couldn't be here this morning that wanted to know, we talked a little bit about policy, but what can people do, you know, at a local level, regional level, state level, national level? What can you do to better engage and inform the people that represent you? So I know that was a big question, but it was sort of like, what can I do? What kind of action can I as a citizen take? But at those different levels of government, what can those policymakers do too?
They can do a
Support.
lot. I mean, Minnesota allows local control for tobacco, unlike cannabis. Cannabis is going to be, you know, the state is licensing them. But for tobacco, you know, a local municipality can do a lot. You can restrict all sale of all flavored commercial tobacco products. You can limit the number of licenses you're going to give out. I mean, you know, how many is too many tobacco outlets, like Erin was saying, in their community? You can limit where they are. You can limit the hours that they sell. There's so much a local community could do on vaping store. You know, they can say, we don't want any of these stores here. That's all you're able to do at a local level. As you go up levels, you know, our power diminishes, but we still have power. We're powerless when we remain silent. You know, silence is giving your power away. So educating them, I mean, just saying, I'm a constituent and I'm concerned. And then asking them, what are they hearing? What would they like to know? I mean, I had a very, very rural school tell me their young girls are selling sexual favors to get vapes. No, this is a serious, serious issue across. This isn't a partisan issue. These are everyone's kids, not just those people or that color or that. It's all the kids. So inform them. You know, if you don't like to email or, you know, I mean, if you don't want to do a phone call, you know, send them an email, send them a handwritten letter. Tell them you want to sit down and have coffee and talk to them about this, that we know this is going to get brought up and we're looking for their support. Because like Janelle's saying, the schools are struggling. We need them to lead and to support the efforts at the school level. So, and don't assume the federal government's going to do it. You're going to hear that the FDA is going to restrict all flavors. You're going to hear it soon. I guarantee you within 48 hours, they're going to be sued by the tobacco industry. And they're still held up in court over graphic warnings on tobacco packages over 10 years ago. So we can't hold our, oh my gosh. And this is when we were functioning at some level as a federal government. Do not count on these folks at the FDA that they're going to be able to do it. There's good leadership there, but it's political. And so, but it still needs to be said to your decision makers that we want this. You know, I don't want to go to the Capitol. I'm the lobbyist for the Lung Association, Minnesota. I don't want to hear one of those decision makers say, no one in my district says this is a problem. And for those of you that belong to organizations that can pass resolutions, pass a resolution. How the dang hard is that? It's just not. I just think we need, you know, it's so good to talk to women that want to like leverage their power. Let's have our voices. The young women on here, Erin made a beautiful plea about being nervous and testifying. I mean, it gives me the chills to think of those circumstances where I've heard those. People say it's the first time I've ever been to a city council meeting, but I want to tell you this. And they do listen. They do listen. So, don't, you know, use your power. Use your power.
Use your power and use your network. There's the big P. There's going to the city council meeting. There's also just talking about it. I have a friend who owns a shop downtown, and she was called really frustrated because a vape shop was going up next door to her shop, and our downtown is trying to revitalize. They have beautiful boutiques and restaurants. And now a vape shop is going up downtown, and they don't feel like that is the brand that they're trying to create as a downtown association. And when she talked to the realtor who had marketed that space, the realtor said, well, there weren't any other vape shops down here, and we felt like there was a gap in the market. And so this young female realtor literally sought out the vape shop and placed them in that neighborhood because she felt like there was a gap in the real estate market. What a missed opportunity, because this is not a bad person. She's not, she's not a terrible person. She just didn't have the information to know that we want fewer vape shops. Let's not make it easier for them. Let's not make them more saleable. Let's not put them on our main streets. She was looking at it from a realtor's perspective only because she didn't have the information.
Wow, that's
The other-
incredible. Wow.
The other piece, can I add one other thought to that is
Mhm.
I recognize the very real pressure that our city council members are in when they have community members saying, I need a convenience store to send my kids to get milk and eggs. I need a convenience store to be able to, right? It's a twofold conversation because there's something, I mean, we have to remember that our city council members are trying to balance balance that conversation, because our communities also want to have conveniences, and we want to be able to have a gas station where I can buy fuel instead of having to drive down the highway. So especially in rural Minnesota. So I think it's a really tricky dialogue, but I think, Pat, one of the things that I heard you say that I think is a really strong advocacy piece is about the limitations, not just the exclusions of, right? So putting that, that there are, it's not about the flavor, and it's about the time, and it's about the age, and it's about the marketing or whatever, I think there are some ways to have that conversation to support the economic growth of having, opportunities, but at the same time, limiting that conversation to what it contains. It's just like in a liquor store, whether the liquor store is allowed to sell, whether they're allowed to sell THC beverages or not. It was the same conversation. And so the liquor stores obviously pushed back hard to say, we're serving what our community wants, but what does that mean, and what's that dialogue look like? So it's just, I think it's also a really trying to balance the demands and the conversations that our council members hear.
It's a really good point. I grew up in Candy, Ohio, and then spent a lot of time on the road visiting rural communities when I was with the Lung Association. My father-in-law was a city administrator of a small community for many years. And as I was seeing dollar stores pop up in small rural communities that were just crushing the local retailers, I asked him, well, why are they letting them come? We know what's going to happen next. And his response was so important. If the community doesn't have a policy in advance of their desire to come, you have to let them come. You can't just say, well, we don't like your particular store, so we're not going to give you a permit.
Oops.
It doesn't work that way. And so
I was listening to a weather here.
Of that policy work, whether it's restrictions, whether it's proximity to a school, all of those things before it's actually happening, because once they're there, it's too late. It's not too late. It's a lot harder.
Yeah, and I do think there's, I appreciate that conversation, but I think public health comes before profit. And I do think that decision makers first have to think it's public health, because the implications of what's going on right now with vaping devices is huge. And I think it's going to be interesting conversations that rural communities and small, I was hoping that the cannabis would be local control, because I think there's a lot of communities who don't want dispensaries. And I've said for years, we didn't think about where and how we want the deadliest product in our country, tobacco, sold in our communities. And now we're going to have very thoughtful conversations about dispensaries. And so it is, and Erin's right. It's like once they're here, then you have those. But I heard enough hues and cries during trying to restrict the smoking in bars and restaurants. And I know those owners thought they were going to go out of business. They really did. They were passionate. They were sure. And guess what? It just didn't happen. People learned how to differently. So I do think the epidemic we're in really requires some from catching up, and we're not going to catch up unless we take
Absolutely.
some bold actions.
Some bold action. I love it. And I know we are out of time. This has been a great discussion. I just wanted to share that this vaping webinar series is a 3-part series, and this is part 2. And want to thank everybody for participating today. Our next webinar will be in early December, and we're going to be, one of the presenters will be featuring is an environmental science professor at the University of Minnesota, and her main research area is vaping and tobacco use. So please join us for that. And again, I want to thank the presenters, want to thank everybody that came this morning.